Hello, my name is Dr. Kashif Abdullah, and I am now continuing my series on 10 things to do to become 100 years of age. And the next thing I want to talk about is controlling blood pressure. So, blood pressure control is perhaps one of the biggest things you can do to help your longevity. Blood pressure affects a lot of end organs, and end organs are your kidneys, your eyes, your brain, your heart. Every single major organ gets affected by high blood pressure. So what I'm trying to show you is ways to lower your blood pressure. Now, an ideal blood pressure is usually about below 120 over 80. And there's a whole bunch of classifications regarding blood pressure, like blood pressure at 160 over 100 or 140 over 90 or what have you. But the goal is basically around 120 over 80, okay? And what I'm trying to show you is how you can get to that blood pressure without any kind of magic pill. The best way of doing these things are all common sense ways, and I'm going to illustrate all of them. But this is how you do it there is no gimmick, there is no trick, there is no pill. There are medicines, but there is no thing or supplement. It starts off with weight loss and weight control. So if your BMI can be about 25 or below 25, you can go on the internet, find a BMI calculator. It's very simple. You just put your height and weight into that, and it'll come up with a number, and you're looking for a number below 25. Another thing is the waist circumference. So you want basically less than 37 inches for men, and for women less than 31.5 inches. So that's your basically truncal obesity. Weight is humongous, and that plays a huge role. I have patients who, after about 20 to 30 pounds of weight loss, stop taking blood pressure medication. So weight is one of the biggest things. Weight control and weight loss is the biggest thing you can do for lowering your blood pressure. Another thing is limiting your alcohol use. So we're looking at about 0.5 to 1 ounce a day. So that's 15 to 30 milliliters in a day, and that's about it. So excessive binge drinking and what have you is something to be avoided at all costs. But limiting your alcohol is important. Also, aerobic exercise. So that's basically like 30 minutes a day. I tell patients, listen, I don't care if it's just walking 30 minutes a day, but 30 minutes of something a day. Of some kind of exercise is a good goal. I don't care about heart rate, some kind of exercise to incorporate into your lifestyle, but 30 minutes of exercise. Reducing salt is another thing, less than 2.4 grams of salt in a day. So if you can reduce the amount of salty potato chips you're eating, or reduce any kind of salty foods, try to reduce that sodium. That's one of the biggest things actually they do in the hospital. They'll put someone on a heart healthy diet. That's basically controlling the amount of sodium they're taking in, because sodium is related to blood pressure as well, or sodium intake. Another thing is stopping smoking. These are all common sense things. Not drinking as much, stopping smoking. Smoking, I cannot emphasize how much you need to stop smoking. No amount of medicine can stop the amount of benefit you can get from not smoking, and I don't care what kind of smoking, if it's cigarette smoking, pipe smoking, vaping, all smoking is smoking to almost every physician. Stop smoking. That's the most important thing you can do. And then reduction of saturated fat. So that's reducing saturated fat is basically, if you turn food labels around, you'll see saturated and unsaturated fat. So that's in red meat and what have you, but reducing your saturated fat. And then after all of this said and done, then comes medicine. Now, many patients or many people, when they're in their 40s and 50s and 60s, they usually go here and they don't do these things. This is for everybody: weight loss, limiting alcohol, aerobic exercise, reducing salt intake, stop smoking, and reducing your saturated fat. This is everyone can do, and these are all scientifically based methods of reducing your blood pressure. If you do these, you might not even need, frankly, your medication. But if you don't do all these, or if you don't do all these, and you still need to control your blood pressure, which you should do even from the early age of 20s and 30s, taking medication may be a way to do, and that's when you come to your doctor and we tell you and we monitor. We give you, depending on what your family history and or what your other comorbidities or problems are, then we can tailor certain blood pressure medications. But honestly, these are things you can do to even avoid taking medicines. All right. So again, this is Dr. Abdullah. If you have any questions, you can feel free to comment below, and I'll see you in the next video. Thank you again. Bye-bye.